today we will be discussing about assessment, clinical features, and treatment of high-functioning autism in children. Of course, before high-functioning autism, we need to focus a bit on autism because autism spectrum disorder should be known now by specialists so that we do not overlook the symptoms. What is the autism spectrum disorder, particularly appearing in the first years of life, impacting social development, communication, characterized with repetitive behaviors and motions? It has a neurodevelopmental origin. We are speaking about three different development areas that are problematic. The first one is social interaction, second, communication, and repetitive behaviors, and limited fields of interest, we can say. A brief video I'd like to show you. If we can run the video now.
This is the story of a boy who didn't talk for a long time. The boy liked things to always be the same. Any changes would scare and upset him. The unknown was an unfriendly place. The boy was very sensitive to lights and sounds. So he built secret hiding places where they couldn't get in. The boy didn't like looking people in the eye. He wasn't trying to be mean, it just made him feel uncomfortable. Sometimes he would flap his arms again and again.
One day I found out I had something called autism. My family got me help. Slowly, I found my voice and learned all the ways I could live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
As you can see on an animation, autism is on the rise recently. Now it's up to 1 in 36 people. It used to be 1 in 88 when I was a resident first, now 1 in 36 people, and it's rising even further, 3 to 5 times higher in boys than girls. And in 70%, there is also mental disability. And I will be speaking about a non-existing 30%. Why rising? There are question marks. Of course, we have more awareness about the condition. At the same time, we have more people working in this field. Together with DSM-5 diagnostic criteria changed, and genetic factors are also effective, particularly advanced parent age and other, particularly maternal age, but also paternal age, may lead to chromosomal abnormalities, triggering a rise in the prevalence of autism. Etiology, many factors are present, but there is nothing that is 100% responsible, particularly microstructural differences and the brain link problems, one of the hypotheses say. Genetic factors, gene to environmental relationship also emphasized. Those having autism spectrum disorder in a close relative is 40 times higher likely to develop autism spectrum disorder. Hyperserotoninemia indicated, ambient factors, thalidomide or mercury in poisoning, immunity, and the mental theory will be discussed later on today. And when we check the DSM-5 diagnostic criteria, firstly, class A are quite important. We want them to be present, all of them. All kinds of communication and interaction problems. There is no social reciprocality. Also, there are problems about developing friend relationships. And B criteria, 2 of them would suffice for us: stereotypic or repetitive motor movements, extreme dependence on routines, and beyond that, limited fields of interest and sensory hyper or hypersensitivity may be present in this population, as will be discussed later. Now let's turn a bit to high-functioning autism. HFA will be the abbreviation that I will use in the rest of the presentation. Before HFA, we need to concentrate a bit on Asperger's, originating from Hans Asperger, a pediatrician from Austria, active during the Second World War. and I will just talk a bit about his activities. Actually, he himself discusses that he may have some kind of Asperger's as well. Those who have difficulty in recognizing gestures and behaviors or mimics of others are detected, named as Asperger's, and included in DSM. He says that we are sure that autistic people will find a place in social community and fulfill their responsibilities and roles maybe better than many other people in the rest of the society. We talked to autistic people and they've confirmed it. Actually, so far, he was considered as a hero, but now, after a study that was conducted in 2018 with the findings, actually, it was found that he supported the Nazis, and euthanasia also led to the euthanization of almost 800 children. Therefore, the name Asperger syndrome is now rather replaced by other names in the literature. Well, high functioning autism, what are the peculiarities? Asperger's is relatively related to normal language development and quite fair cognitive development. Social interactions and communications or repetitive behaviors and fields of interest were also limited as a characterization. But high functioning autism is different in the way that language development is not a primary factor because in time they may also acquire language development even if they have at first limited language. But this group of kids do not have fairly good level of mental development. Level 1 is the group that requires support indeed. With mental problems and also findings of autism. In the ICD-10, we are speaking about the same definition of Asperger's, whereas in ICD-11 it's replaced. And now we can see that without disorder of intellectual development and functional language parts were included. So the functional language is not very important in HFA, but these are the new diagnostic codes. Now we are using this part and this diagnosis, particularly for high functioning autism diagnosis. It affects 0.5% of the entire population and comprises up to 30% of the entire autism cases, which is quite high. Well, as for the clinical presentation, the ages 2 to 3, ages 4 to 5, and school behaviors, a child at the age of 2 and 3, what are the peculiarities? So we can differentiate in terms of mental development and language development. These are quite fair. They generally tend to prefer to be alone. Social smiling may not be present. They may not be attracting the attention of adults. They may have limited eye contact, may not react with the name calling, will have a limited emotional expression. And they may have some problems in terms of clapping all the time. What are the specific fields of interest, like revolving objects or sensory sensitivity lacking, licking also may be present. At the age of 4 to 5, it's more predominant. The diagnosis generally is diagnosed at the age of 4 to 5, although we may diagnose at the age of 2 to 3 for general autism. High-functioning autism may be better diagnosed at the age of 4 to 5. Gestures and mimics are limited. Peer relations are problematic, may also have comprehension at the same time, may also be aware of what's going on around, but has difficulty in expressing emotions, repetitive behaviors, rituals, specific fields of interest still there. And school age. Autism is divided into 3 parts. School age is active but weird type of people with good intellectual development, but social clues are not apprehended. They have relationships, but weird as named by the peers, but sometimes may have problem in terms of adjusting behaviors and the tone of voice, speaking as an announcer, sometimes monologuous speaking, and has difficulty with routine changes, also has specificity or hypersensitivity to pain, to light. This study also comprised of the symptoms of high-functioning autism. What are they? These are the children who would speak more time with objects and physical systems rather than with human beings, communicates less with human beings, and follows his own impulses rather than the instructions of others. Also has less interest in social groups, wants to spend time alone, has quite high level of interest in, as an obsession. Details are perceived quite well, never forgotten, and sometimes reminding of these details, and sometimes may have difficulty in perceiving the world. What are the materials that these children are affected of? The designs, visual designs, timelines, dates, traffic registration plates, cars, songs can be well differentiated. Light buttons or taps or the complicated, like the weather condition may also have a impact on the moods, mathematical systems, and also mathematical systems, flags, train maps, types of different dinosaurs or wizards. I mean, the types of fabrics, so on and so forth, are quite broad fields of interest. Also, although controllable experiences are strongly preferred, change has a negative effect on these children. As for clinical diagnosis, I mean, how do we obtain this data? The most important thing, of course, is the history given by the parents. Secondly, our clinical observation. These are quite relevant as combined with developmental history. And we ask for video recording from the families. Their home-based behavior is important. Tests ADOS and ADR, quite important, translated into Turkish as well. And 3DI we conduct. ADOS is the pediatric version, and the 3DI is applied with also the parent supervision, will give us some percentages and possibilities about the presence of autism. Scales. This is the scale, for instance, ASSQ. Well, particularly about the peculiarities of the Asperger's syndrome. Like old-fashioned, the children consider him or her as weird professor. He lives as if he is in his own world, has different language, own words spoken. I mean, these are the details of the scale. I would highly recommend this. Clumsiness, for instance, bad at play and doesn't have any idea about team cooperation, keeps record of his goals. I mean, quite interesting scale. Also, we make a medical examination, may refer to dermatology or neurology, depending on the peculiarities of the case. Age is important, the level of assessment is important, and we may also ask for advanced assessment. What do we check in psychiatric examination? Cognition, important, social adaptive behaviors, language development, and behavioral functions, self-care, and if there are other comorbidities, we pay attention to them as well. In differentials, there are two diagnoses we should focus on. One is the social communication disorder, the other one is HDDA. Actually, social communication disorder is recently introduced into definition. Class B diagnostic criteria are not present here. Repetitive behaviors and the sensory sensitivities are not present here. Social and pragmatic language usage is problematic. I mean, these are the diagnostic criteria. There are problems in social communication. Will not say hi or will not respond to it. has difficulty in, waiting for his turn during conversation, and sometimes realizes that he or she is misunderstood but cannot correct. At the same time, will not have any good adaptation. Should have a formal language with the principal at school and will have a casual talk with the friends, but they will be speaking the same way with everyone, and will have difficulty in perceiving actually the proverbs, and humor is missing. ADHD is quite commonly present, so it's a co-founding factor. Sometimes the hyper functioning autism may be overlooked in ADHD children because of the 50% they may exist together. So after having treated ADHD children, during the follow-up, if the problems persists, particularly in social fields, particularly we should be considering about high functioning autism in this group of children. In terms of comorbidities, ADHD is number one. Also, behavioral disorders and anxiety disorders are quite common. In adolescents and adults, depression is quite dominant because probably they become aware of the problem that people consider them as weird, and willingly or not, this may also turn into depression. So depression may also be present at the same time. In the progression, although they have good cognitive functions and intelligence, unfortunately, they may not find a good job and they are not autonomous. Therefore, at the end of the day, they are dependent on their families all the time, which is a long-term problem for this group of individuals. For the treatment, let me briefly speak about the treatment of autism. Special treatment is particularly recommended and is inevitable, age-specific. Applied behavior analysis is important. Early start, Denver, pivotal response training are the behavioral methods, and families are required to take part in treatment. What is treatment in HFA? It's multi-tier and multidisciplined approach, because these are the children who come at late ages. Sometimes we see them at adolescence and sometimes in adulthood. Early intervention is extremely important. Therefore, we may run behavioral, psychosocial, educational interventions at the same time. Cognitive behavioral therapy comes first, particularly for anxiety disorder, and management of anger is important. Social skill deficiencies should be overcome. And MBT is promising. At the same time, there is also studies about the social skill training, and cognitive behavioral therapy is also included. And in terms of clumsiness and these kind of problems, ergotherapy and physical treatment may also help for these children for motor development. There is an intervention plan for children and adolescents. We have psychoeducation and a reward system, cognitive restructuring for anger management and anxiety disorder. There is a hierarchy created. Also, the parent training is important. We also organize game plays together, with us, and how to start a game and how to communicate. The social skills training is included in this area. We perform social coaching, mentorship, and the schools are also involved here, because these are the children who would be exposed to bullying all the time. So Beje is a good example for social skills training between the ages of 5 to 7. It's a very simple technique to be applied. Last 5 minutes and I will wrap up. Well, for psychopharmacotherapy, of course, autism unfortunately doesn't have a pharmacotherapy as until today, but comorbidities and behavioral problems may be treated by risperidone and aripiprazole for atypical antipsychotics, as for irritability, or mood disorders, stereotyping, and hyperactivities. Olanzapine also may be preferred in severe cases. About ADHD, methylphenidate would lead to irritability and emotional problems that occur. Therefore, atomoxetine is our preference, and guanfacine is newly introduced into the Turkish market. So we may also prefer because it may help these children continue with their lives. SSRIs in the presence of anxiety and depression may also be preferred. In conclusion, adolescents and adults diagnosed with HFA represent a group that is underserved as a part of the complicated health system. They may come with another disturbance, particularly at the age of adulthood, as the speakers will be dealing with after me. They would face a lot of psychiatric and psychosocial problems. They cannot name it, so no one would diagnose unless they apply to us. These social skill problems lead in time to depression and anxiety problems, unfortunately, in time. Although it's very common, there are very limited studies, particularly on treatment. CBT and social skills training are quite influential in this field. CBT is found to be the most effective method, and there is this need of dispersing these therapies throughout our country as well. Thank you for your attention.